Hi, my name is Lauren Micciantuono. I'm 57 now. I was diagnosed first in 2020, January. I had seen a dimpling underneath my right breast and thought I would have it checked. I had gone for my routine mammograms pretty regularly. When I did go, they saw something, had me come back for a diagnostic ultrasound, and then biopsy confirmed that I did have the most common breast cancer, DCIS, stage 2. Within 2 weeks, not even 10 days, I was at Dana-Farber going through all of the pre-testing. And of course, 2020, it was the beginning of COVID. My family had come with me to that first visit, but right after that, everything was shut down. And I then had to face all of my treatments by myself, driving into Boston and all of that by myself. That was hard. Because the world was shut down, I didn't feel like I had to go out and have people staring at me, losing my hair, but I was alone. I couldn't see my mom. I couldn't see my family other than my husband and my 2 children at that point. That was in February. In June, I had my surgery where I just had a lumpectomy. They seemed to get all the margins and everything was good. After that, I went through radiation. That was 30 treatments every day. And I was clear sailing from there for a couple of years. A new medication had come out to prevent metastatic breast cancer. So my team at Dana-Farber put me on this drug for 2 years. 5 days before I took my last dose, I went to Dana-Farber with my daughter in the intent of going to Boston Seaport for a festival. And I just figured this was going to be a routine checkup and we were going to go off and enjoy our day. As I'm waiting in the examination room, my portal popped up to say that there were new test results. It was just blood work. I figured, let me look. So I looked, and there was this CA-15 or a cancer antigen test that was added to my blood work, which after the fact found out that wasn't ordered for me, but somehow it was part of my blood draw vials. When I opened it, normal range was 0 to 25, and my number was 46. I panicked. I said, what does this mean? I don't understand this. When the doctors came into the room, they had like this look of, you looked at your portal. And I said, yes. So from there, it was, do you want me to go get your daughter in the waiting room? Please, yes. So she came in and I was already sobbing. They did want me to go have a CAT scan. A year before, they had seen a couple of what they thought was granulomas in my lungs, and they were just watching them but didn't have any concern about them. So they did a repeat of my lungs, my pelvic, and my abdomen. And they showed that those granulomas had grown and most likely would be metastasized to my lungs. Those were positive for cancer. It wasn't a new cancer, it was the same breast cancer that had metastasized. Because I had already had radiation on my chest and my breast area, they couldn't do radiation again. So I'm on oral treatment and shots that I will be taking for the rest of my life until they stop working. I feel good. I've never had any kind of shortness of breath. I mean, if I didn't have that test that day, I would have never known. Whatever divine intervention that was that put that test in my chart that day, I count that as a blessing in disguise. The diagnosis, yeah, it cripples you, stops you in your tracks, and you just don't know where you're going to go from there. But with support of my family and my husband is also going through an illness of his own, so he gets what it's like to be sick and having to push through every day. My kids, my daughter's a warrior. I mean, she is constantly checking on me. My son, he's like, yeah, just take what you gotta do and you get through it, you're fine. I had heard about Gloria Gemma during 2020. Nobody went out. It's not like they were having meetings in person, so they did a lot of virtual things, which I didn't really feel connected in that sense. So I kind of just stayed within my home and tried to get through that part. But when this metastatic diagnosis came around, I didn't know where to turn. I reached out to them again and said, what do you have? How can you help? And what do I need to do to? So Maria got in contact with me and she said, we have a metastatic group. She says, I think it would be beneficial for you to go to the group. Even though you don't know for sure, just go. I came out of that meeting with a whole new sense of what metastatic looks like. It's been the most beneficial, supportive thing that I could have done for myself. I've met many, countless women that are going through the same exact thing as I have, know exactly how I feel, the good and the bad. Our stories are so different, yet they're so parallel. I consider every one of them my ride or die. It's amazing. It's truly amazing. Gloria, Gemma, if you have an opportunity to join them, I mean, even if you're on the fence, just reach out. Maria has been amazing. I consider her probably my biggest advocate. Her thing is, you're never alone. They have opportunities for you to live your life better. You know, when I was in that doctor's office, she said, you know, we have to think about quality of life now. And it's like, what do you mean quality of life? Like, I don't have longevity, but I don't even think of that anymore. I just think of like, you know, what can I do next? What can I go to next? Where can I see next? Where can I travel to next? Who can I meet next? And that's what Gloria Gemma has done for me. I don't think about the end anymore. I think of what can I do now? There's so many things to do, from mind and spirit things, meditation, yoga, cooking classes, grief groups, and just potlucks. It's been truly, truly amazing. Please make sure you go get your mammograms. Don't let it go. Even a year can make a huge difference. If you see something, say something, be your own advocate. I mean, I know October is the big time of year where everybody is, but people get diagnosed every day. It's not just October. So stand up for yourself, be your own advocate, and just make sure you take care of you first.